Hi, everyone. We're getting started with the Heart of Innovation in just a few moments. You don't want to miss this powerful episode.
Sponsored by The Way to My Heart Incorporated.
Welcome to the Heart of Innovation, 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global PAD Association at padhelp.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global PAD Association, Kim McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness, Dr. John Phillips.
Hello, everyone, and welcome to the Heart of Innovation. Today, we're addressing a critical healthcare disparity that's making headlines. Recently, the Society for Cardiovascular Angiography and Interventions, known as SCAI, released alarming findings. Black patients with critical limb ischemia face a 46% higher risk of amputation compared to white patients. They're also 10% less likely to see vascular specialists before this treatment and 10% more likely to require emergency care. These are not just statistics. They represent real people, real families fighting against a system that often fails them. Our guests today, Jay and her mom, although her mom, we just found out, was in the operating room this morning. We'll get to that in a moment. She's recovering. So right now we just have Jay, but both she, her mom, well, they're living with this reality and they're going to share their experience. You know, when doctors at a rural Louisiana hospital told them amputation was the only option for her mother's advanced peripheral artery disease, those blocked arteries in mainly the legs, Jay refused to accept that fate for her mom. Their journey reveals the stark difference between doctors who claim to treat PAD and specialists who have the advanced skills to handle advanced stage PAD, known as critical limb ischemia or CLI. That's a condition more prevalent and deadlier than breast cancer, colon cancer, and prostate cancer combined. This is a story about medical advocacy, healthcare disparities, and the fight to not just save a limb, but also a life. And we're very lucky to have Jay joining us and the CLI operator ultimately fighting for her leg. And they found him through the Global PAD Association, Dr. Amit Amin. We'll get to that in just a moment. It's a very important story. But first, I want to welcome my co-host, Dr. John Phillips. And before you say anything, John, I want to take a moment to honor your dad. I know it's the anniversary of his passing, so I want to just take a moment to honor you and honor your dad, and to also thank your dad for bringing you into this world. And you have spent your life serving others and saving piggies. And for that, we really appreciate you and we appreciate him.
No, Kim, I appreciate you recognizing that. And my father was a great guy, but had suffered from Parkinson's, and it really took away all of his independence several years before he passed away. So today's a celebration of his life, and he definitely would have wanted me to do the show and continue to do this stuff, because at the end of the day, I think you have to be, to your point, you have to be an advocate for people who can't advocate for themselves. And I have a brother with Down syndrome, and my dad was always fiercely fighting to help him get the care that he needed, and exposure and equal treatment. And he's actually at my house right now. We're getting ready for a little celebration. It's only 65 degrees here in Columbus, but I got the pool heated, and hopefully the cousins are coming over and we'll go swimming for a little bit. So it's a celebration. And I know, Kim, you and I unfortunately both share the fact that we've lost a parent when we necessarily weren't ready to do so, but it is what it is, and you got to move on. And you do it, I do it, lots of people do that. So just, I guess, a shout out to all those folks that have lost a parent, and we're here to support you.
Yep, and that's why also we fight for all of those kids who are fighting for their parents when it comes to peripheral artery disease in the advanced stage of critical limb ischemia, and especially Jay. We're going to honor her today for her efforts. You won't believe her story and what she has gone through to fight for her mom.
And it's last week I was off at OSU's student union doing an event for mental health awareness, and it was mainly more guys were there, but I mentioned, and I think we've talked to somebody who was a part of the African American Male Wellness Agency. Who, they do a walk, I think nationally, and their day in Columbus is August 9th. And or maybe it's August 10th, August 9th, but I'm happy. I want to be there. But my point is that African Americans, African American men, for whatever reason, and we need to advocate for everybody, but that particular portion of our population, they don't seek the medical attention that they need. With PAD, also with prostate cancer, African American men are more likely to have prostate cancer at a younger age, and when they're diagnosed with it, it's more aggressive. They're less likely to get screened. And so, we fight for, I think, we want to be preventative. And a lot of what we talk about is being preventive about PAD and controlling your diabetes and the screenings and things like that. And so it doesn't surprise me one bit, those numbers that you reported, 46%, and then, the 10%. And it's just, we've got to do better. And this is a start. So I'm looking forward to the conversation. I always want to save piggies, and happy that Dr. Amin's with us and Jay, and we're going to have a good show. So let's roll.
Fantastic. And before we get to this powerful story and bringing those statistics to life, unfortunately, let's have a moment of inspiration.
Dr. John Phillips' spectacular vascular moment of inspiration.
I feel like I'm a genie.
Makes you smile. We have to do that.
I know we do. And so I was talking to my chatbot friend, Claude, and I said, Claude, find me an inspirational quote about, people, seeking out help on their own and not settling for no. And so Claude, who these chatbots are great, and like Claude, I interact like we're buddies. But Claude said, so the only person you should try to be better than is the person you were yesterday. Never settle for less than you deserve, and never be afraid to ask for what you need. And I think, so that's a quote, we can think about that. And then Nietzsche came to mind as well. And he said, so he who has a why can trudge through any how. So, I mean, if you have a why for something, you can figure out the how. And so I think you marry those two together, and it's about self-determination, not saying no for an answer, finding the right person to help you, whatever it is, and then executing on those objectives. And so I think that's kind of the story we're going to hear from Dr. Amin and Jay. So looking forward to it.
And I think that is a great way to jump to break and then come back and hear the why from both Jay as well as Dr. Amit Amin from Cardiovascular Institute of the South. So stay with us right here on the Heart of Innovation on KDOW. Don't go away.
Leg health can indicate risk for heart attack.
Okay, we're kicking it into gear here. Here
Good
we go.
segment. Do you want to bring?
Thanks for bearing with us through that first segment, guys.
Yep. Thank you.
So you want to take us back in
Sure.
with the why? I know that we're a big part of that story, John, with Jay as well. Because
Do you want me to start the intro with like how you got involved with it, Kim, and then have Jay roll in with Amit, or how do you want to do it?
I mean, it's in the middle of the story. I think that we did it. If you wanted to just kind of unravel as it goes,
Sure.
or do you think we could start there and then backtrack a little bit?
Whatever I mean, why don't we just hear? So Jay, you're representing your mom, right?
Where's Jay?
Yeah.
Jay, did we lose you?
Yes, I'm here. Can you?
Oh, okay, cool.
There's Jay.
So why don't Jay?
turn
Let's
your
welcome
camera
you to
sideways.
let's welcome you to the show, and tell us how how the piggies were saved, or hopefully they were saved, or going to be saved.
Yeah, well, because I don't want to. We have a long story. It's been a whole long. I'm curious because I didn't hear, John, about how she even got when this first started.
Okay.
I came in the middle, Jay, you want to have your camera though on the side if you can, because what it'll do, it's going to distort you, and you're going to call me later and say, Kim,
Back
why
and
did you
dirty.
go on camera like that?
Is that
There you
is that better, Kim?
Yes. There you go. Are you okay with that?
Okay. Yes.
Okay. Because you'll look much better. It stretches you or something weird when it shows up on the internet, when it's that way.
Oh wow. So would you like to just begin with my mom's story?
Okay, hold on one second. We're gonna.
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Thanks for joining us, everybody. Welcome to what I think is going to be another fantastic Save My Piggies episode. So let's jump right in. Jay, welcome to the show.
Thank you.
You are speaking on behalf of your mom, who has what sounds like pretty severe peripheral arterial disease. Is that correct?
That's correct, yes.
So tell us how the story started.
So the story started probably back the day that I actually can remember was July 27, 2009. I remember that day because it's the same day my grandfather passed away. But earlier that morning, my mom and I were exercising. We were walking around the track, and she noticed that her legs started hurting, really bad. I mean, so bad that she had to stop. And it took us a long time to get back to the car. We didn't know what it was at that time. Thinking back now, that was probably the start of the signs showing with her PAD. But started hurting. So probably maybe a year or so after that, she heard an advertisement on the radio saying, get checked to make sure you didn't have PAD. We never heard of her before. So she just went to a screening and came and told that she had some blockage in her leg, based from the vascular screening. So it started, her first probably stint maybe was probably, so it was maybe a year or so after the incident on the track. So 2010, 2011 was probably her first stint, and it just gradually progressed, from that point on. She was getting stints every few years, and then it went from every few years to every, twice a year. Then from twice a year, she was getting cleaned out to maybe every 3 months, and then it kind of just got all the way to the point of she was needing a bypass. So fast forwarding to October 2024, she had a bypass on her left leg. She had a bypass on her right leg as well, but she had that bypass in February 2024, and it was.
So I would imagine the bypass was from thigh to knee or thigh to calf, either what's called a femoral popliteal bypass to the knee or femoral tibial. Do you know which one?
So on her right side, amazing enough, and I've just been told that this is rare. It's from her chest right here, and she has a long graft from her chest to her thigh on her right side, and then they connect from her thigh all the way down to her leg on the right. But on the left side, it's from thigh down.
So wait a minute, and maybe Dr. Amin could jump in here with the clinical look at this. Are we talking not up here, not the axillary? We're talking aortofemoral.
Talking ax tib on the right.
Oh, you're kidding.
An axillary tibial bypass?
Mm-hmm.
Wow.
Yeah.
So she must have burned out all other endo options on that right leg at that time.
Yeah. So I was told, and I was told that when the doctor went in, she had a lot of scar tissue down there. And so originally they were going to go from the hip down, but saw a lot of scar tissue. So they changed routes and went from up here down, from the top down. But yes, it's a very.
Can I hear, Dr. Amin, when you went in and you saw this, I'm curious. I know you can't, 2020 hindsight, you can't armchair quarterback what someone else has already done. But what was your perspective? Because I can see kind of by your face that it's kind of like my face too. I mean, that's rarely done. And I see it done more often by a doctor who does not have advanced skills and just doesn't have anything else to do. So they do the Hail Mary of all Hail Marys, which in England they call the axillary actually palliative care, get your affairs in order. And I'm just surprised to hear that this was done, especially clear down to the calf.
Yeah, I was surprised too, actually, to tell you the truth, especially when I saw an axe tib. Coming back and looking at the anatomy, and I looked at it and I was like, there's other options. I mean, but this was about a year ago. This is 2024 when it was done, and there've been newer technologies out there to avoid that. So I was a little quizzical. Let's just put it that way.
I'm curious, Dr. John, what are your thoughts?
Well, I mean, again, so when we talk about anatomical bypasses and then we talk about extra anatomical, meaning kind of like, so anatomical is basically just it's the way I understand it. You know, you have a straight line, you have a tube, and so you just kind of, you go from a clean portion past the block portion in a straight line, so to speak, or parallel to it. And then an extra anatomical, I mean, you're going opposite direction potentially, or you're going, you're connecting two places that don't really connect naturally. And interestingly enough, I mean, so for oftentimes when axe fems are performed, it's because either the aorta or the first branch from the aorta, the iliacs, are blocked. You can open, I mean, it's a little difficult, but I mean, there's really good, as Amit was saying, like there's really good options there and very durable options too. I mean, if you can get through it and put stents in, you do it right, those stents last forever. I mean, it's a little different. I shouldn't say forever, but much longer than stuff in the in the femoral and the popliteal and the tibials, of course. So, I mean, when I see that, I think, man, this person must have exhausted everything.
Well, everything, right? Or just everything in their armamentarium. And our philosophy at the Global PAD Association is don't give up on the patient, give up the patient. Always make sure to get, and that's where Jay finally was like, I'm done with this whole thing. I am there has to be other options than whatever they're doing at this point. But I know that Jay, she had the axillary bifemoral bypass. It was bifemoral or just axillary tibial on the one side.
So
It's
February, February 2024 was the one at the top. And then, yes.
And then what happened?
And then so that one, we actually didn't have any, I mean, it happened. She healed well. She left the hospital with like 14 wounds. 14 wounds at that time. And so we actually used topical oxygen and advanced wound care techniques, and all of those wounds healed fairly quickly. So I would say by May, she stayed in the hospital probably for 6 weeks with antibiotics. By May,
Jay,
she was doing what? Yes.
Jay, sorry to interrupt, but this is at your local hospital, or is this through the connection with Dr. Amin?
At my local hospital.
Okay,
yes.
So you haven't, the two of you, or the three of you
haven't met yet.
Okay.
No, not yet. So she left probably in May. By July, she was, doing well, and we were on our way. However, end of September, she started having that same pain in her left leg. So October 2024, we went in for a bypass on the left leg, same local hospital, and she had all kind of complications. Literally, that bypass site on her thigh, the doctor entered her thigh and around her calf, and her ankle area. The thigh portion where I was told he used a cadaver artery, cadaver vein as well, in the graft, but that spot on her thigh literally ruptured 9 times from November 2024. The last rupture was January 2025. So we were going to back-to-back hospital stays. The first rupture was at our home. The last rupture was at our home. The other 7 ruptures happened in the hospitals. One rupture actually happened twice in one day. So they were going in, repairing it. It would rupture again, they would repair it again, it would rupture again. So it's just like a repeat back and forth of life-saving surgeries that she actually had to go through. So the last surgery rupture, she was at home. It was really, really horrific. And And what ended up rupturing was her artery at the site of where the cadaver vein on her thigh. It literally ruptured. And then when I say ruptured, I mean imagine turning on a faucet and blood shooting out. It was just, you know, a horrific scene. It was like out of a sight of a movie. You know, I took pictures at the house and it looked like a murder scene. It was just so much graphic.
Sorry, I'm just gonna ask Dr. Amin, like, can you provide a little, we've got about a minute left. Just so what, like clinically from a medical standpoint, what is there dehiscence at the anastomosis or what's going on here? Do you know?
So from what I can tell from the wound, it was just wide open. But looking at the angiogram, I obviously didn't see a fem-pop bypass take off anywhere. And so clinically, when I looked at it, I was like, there's no bypass here. So when Jay was saying that, I'm a little quizzical because I didn't see any staples. The only staples I saw was down at the knee area. And I didn't see anything up towards the groin. And so to having that area in the thigh, I saw the wound there, and it was definitely open. But it's just I'm trying to piece this all together myself right now, actually, because it's just still open. A lot of questions that I'm still trying to figure out too. And Kim and I had talked about this earlier, and I don't want to say on here anyway, but so it's just a lot of open-ended, open questions that I still have floating around, and I don't want to be speculative, if that makes sense.
Well said.
Yeah,
Well
but
said.
how Dr. Amin is helping to take her care forward and how Jay found Dr. Amin. Well, that's next right here on the Heart of Innovation on KDOW. Don't go away.
3 years ago, my symptoms started with leg pain and
So because my understanding was there were two aborted bypasses, Jay, but this was a whole other
Yes.
before aborted. So
Yes.
did they take those out? But you said, Dr. Amin, like there was no sign of it.
Yes. So I actually that site that's actually open on her thigh, it used to actually have surgical staples there. However, it actually healed. It healed with only a little spot of opening. However, after the last attempt, maybe about 4 weeks ago, to redo another bypass in that same area, he did not open up that area again. He actually went down on her near her, what the wounds that dehisced now, and that area is where he tried to open to do the additional bypass. You know, so he opened those areas down, but he could not, you know, he said he couldn't connect to anything below the knee. And that's what kind of led us to finding you. When I got the news that, you know, he could not connect to anything and there was nothing more he can do, he kind of just sewed her back up and they put her out the hospital. And that same day I was like, there's got to be a support group out there for people with PAD. And I just searched, like I did a Google search and it led me to you. And then that's how, you know, we ended up getting with you and Dr. Amin and all of that. And I'm thankful for that. But yeah, we had two, he went in probably January 7th to supposedly take out the bad portion of the graft, because I was told that it was getting infected. That was the cause of all of the ruptures. And she stayed from January to February in the hospital for another 6 week stay on antibiotics, you know, and then from staying in the hospital there, the last rupture, the CT scan and the ultrasound showed that the graft had failed. However, the next day they started hearing a pulse in her foot. So it was like, oh, okay, she's okay now, you know, and they moved her to a longer term facility in the hospital on another floor where she got the antibiotics. But she never, like her mobility never improved. You know, her wounds and the site that kept rupturing improved, but the wound never, I mean, the mobility didn't. And it just kind of got worse again. So when we went again in at the beginning of April for another CT scan, that CT scan basically showed the same thing the January CT scan showed, which was the graft had failed. And that's when
Back in 30.
Okay, went in again and tried to restore it and said he couldn't.
Okay. Oh, that's a lot.
It's a lot.
John, take us back.
Worth watching. The new Salem News Channel.
greatest collection of conservative minds, all in one place. Mike Gallagher and more. Watch anytime on any screen. Free 24/7. Find what you're looking for at snc.tv.
1220 KDOW. 1220 KDOW. Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Thanks for joining us. Let's continue this conversation. Clearly, there are some piggies that are in jeopardy here on that left leg. So, Jay, you're frustrated to some degree with what's going on. How did you get in touch ultimately with Kim and the Global PAD Association, and then ultimately Dr. Amin, who sounds like helped your mom pretty significantly?
Yes. So after being told that there was nothing more that they can do to restore blood flow at my local hospital, I said, maybe there's a support group out there, for people who've gone through things gone through situations like I've gone through. So I did a Google search and it led me to Kim, the Global PAD Association. And I kind of started looking at videos that you guys had. I decided to join the support group, and I privately messaged Kim, and immediately Kim responded back to me with hope and options. So, and she was able to successfully connect me with Dr. Amin, and the rest is history. I'm thankful. Kim and Dr. Amin have just been wonderful through this process. They've given us a level of hope. They've given my mom hope. When my mom was told that she was being transferred, my mom, her only request is just that she wanted a second opinion. Having an amputation is a life, it changes your life forever. So my mom said before she moves forward with any discussions of amputation, she wanted a second opinion. And so I wanted to try to give my mom that. And with Kim help and now Dr. Amin's help, she has blood flow now. So I'm just
so Jay, if your mom would not have said, "Can I get a second opinion?" which we encourage everybody to get one, regardless of what their medical condition is or who's treating them. Do you think she just would have lost her leg?
Yes, I do. She would have lost her leg. It was at my local hospital. It was no discussion or no, when they kind of just deemed us as crazy or, making a wrong decision. There was no hope. She needed an amputation. There was no discussion on limb saving, no assistance with limb saving, but a lot of discussion, a lot of resources in regards to amputation. So I know
it sounds like, though, you were happy with what they did on the right side. I mean, the complex procedure, hyperbarics, it sounds like, good wound care. Were they just kind of, and this is just me editorializing in my opinion, but did they maybe just kind of have enough of the vascular issues with your mom? Or what do you think?
I personally think, and if I'm just speculating, I just think they just didn't have I think they had the desire to try to help, but they didn't have the tools to help.
Good. Okay.
Yeah, the technology was not there, and the knowledge was not there.
Did not put up a fight with the second opinion with Dr. Amin.
Oh, they did put up a fight. It was a major fight. Put up a fight.
Oh. Yes. Okay, well, let's hear the story. Okay.
Yes.
An advocate, Kim, had to tell Jay to get her cute little butt turned around. Those were my words, weren't they?
Yes.
Back in that hospital. Because the initial thing when they first released her from the hospital, we were going to get her to Cardiovascular Institute of the South with Dr. Craig Walker, who's the CEO. And he's like, I'll see her Monday. Next thing you know, they're actually telling her, once she tells them that she's going to Craig Walker, oh, no, you don't need to see him. You shouldn't go and see him. And they, instead of releasing her, they kept her and just dragged her feet. No, you need to stay here. You need to go with our options. And finally, literally after the appointment, she had told them it was going to be a Monday. Well, they deliberately kept her past the appointment so she couldn't go. And then they finally released her. We scheduled another appointment. But by then, as you know, time is tissue. And she called me and she's like, Kim, we're not going to make the second appointment. I had to bring her back to the emergency room because she has an infection and it is getting worse. Right, Jay?
Yes, exactly.
And that's at the point where they said, we got to do the amputation. You have no choice. And I said, you need to get a hospital to hospital transfer. Put in that request. She put in that request. And what was interesting is that they weren't completely truthful with you at that point
Yes,
about
exactly.
whether or not they were accepting hospitals.
Right. They told me that there were no accepting hospitals at one point, and then they told me that my mom's insurance wasn't approved. Then they came back and said the insurance was approved, but then there was no accepting physician. So it was just a lot of, miscommunication, a lot of things that kind of held my mom there. Each day we just felt defeated. And we were losing hope. It got to the point that I was like, just discharge her. I'll take her myself. It was that it was stressful, and it was just sad, and my mom was sad. I could just see it all over her face. Each day we literally felt defeated.
How long were you there for?
2 weeks.
And coming up right here on the Heart of Innovation, you're going to hear how the transfer occurred and the rest of the story. So stay with us right here on the Heart of Innovation on KDOW. Don't go away.
2 weeks, golly.
So the revasc
gets-
was recent
it
that you
gets better.
just did this?
Yeah, just this week.
Yeah, this week.
Okay, so this is what, late April, early May, or late April, you're in the hospital
Yes.
dealing with all these things.
Yes.
This was like what, last Friday.
The interesting
quickly-
comment. Oh, sorry. Like we see, I see this now, and so yes, hindsight's 2020, but you wonder, and this is why, like, we've learned a lot of lessons about intervention, or at least I hope we have. You cross the Rubicon only when you have to cross it, in the sense that once you have a procedure, you're having another one in your leg, and so if you can put it off as long as possible, I bet. Maybe not. I don't know. And maybe your mom was so debilitated by the PAD that you had to do something. But I have personally seen patients who their bridges are burned because they've had so many procedures, and they started out with 3 vessels going to the foot, and each subsequent procedure they lose a couple. They nick one. And it's a snowball effect, and that's why I think a lot of us are very fierce in our determination, or at least our recommendations, to only proceed in a claudicant, not someone who has critical limb ischemia. Different story, 100%. But
it's completely different. Yeah.
You just wonder, like, how many limbs could have been saved if we as a group would have just left them alone. I don't know.
Yeah, but that's not even the majority, which is sad. But it's just these people that are not skilled that are doing things they shouldn't be doing. Because the advanced skilled doctors, we had 2 ICs, Dr. Pliegas and then Dr. Lala. And they both told me, because we had a patient that was up for an axillary, and we wanted to prevent the axillary. He was a young guy. And we figured at least like aorta bifemoral, but let's see, because we've had a lot of patients that we've gone TPA, thrombectomy, and no bypass was needed for the aorta and iliacs, for aortoiliac disease. And with both of them, they were like, you know what? In this case, we're not going to touch them. We're not going to take a risk, send them to a vascular surgeon. And so these advanced CLI operators are not ones that I think that class, I don't think they're doing, you guys don't have time to do intermittent claudicants. That I know of. They,
well, I mean, we see them. I see them, but the problem, the problem with endo, I don't know. I mean, I don't know when we go. Well, there's 4 segments. Okay. But the problem with endo is that it's the Wild West, and we still haven't cornered the market on how to actually treat it such that you get very good, durable results. We get spoiled in the coronary space because pretty much if you have a blockage and you're symptomatic, you get a stent. The stents are put in appropriately by most people, and they last a long time. And there's certain expectations, and there aren't expectations in the PAD world, at least in endo and surgery for that matter too. And that's part of the problem. And we are going to continue to have that problem until we, as a society, figure out how to regulate and put guardrails around people that are doing these things.
Yeah, it can't just be everyone who has the title, because wait till you hear about 2 more experiences this week. You're gonna die. Like, awful. And two of the patient, they didn't have PAD.
Oh gosh, jeez.
Don't even get me started. I can tell you offline who one of the doctors is, and the patient has actually already filed a lawsuit. It's really awful. It's in Florida. But needless to say, so I want to start out, if you don't mind, I'll just start out.
Yep.
I just want to start I'll finish that part because I want to get to Dr. Amin because I want to hear everything that was going through his mind and what he was able to do. And then we'll quickly get to where we're at right now. And we have to remember that this is something that we don't know. There's still a we don't know at this point. You know, when you make those decisions, right? Thank you, Chris. When you make those decisions to get these treatments, it's like you're coming to a Dr. Amin, like, poor guy has to clean up the mess. And it's easier if you start choosing the right doctor sooner and plan for the long term. And hope to God you never get there because you choose the right doctor.
Comes to job performance,
you got to do it.
48% who disapprove. This
right?
is SRN News.
Both of you would rather have
20 KDOW.
early.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back to the show. We're continuing with Jay's determination to save her mom's leg. We're talking about her local hospital, how she met the Global PAD Association. We pushed her to try for a hospital transfer. The doctors gave her a really hard time about it. And so we got involved. We ended up getting a hold of Dr. Craig Walker from Cardiovascular Institute of the South. And he said, hands down, you've got to get a hold of Dr. Amit Amin. But he was busy. I didn't want to bother him again. So I went to a company called Endologics and I said, who's your rep over in that area? And they got on the phone with Dr. Amin and made the introduction and said, hey, can you help the Global PAD Association? And this was on a Friday night. And he said, I will accept the patient. I will take care of it. No problem. We'll give her the best try we can. And I said to Jay, go for it. Tell him we're going to do it. And what did the hospital say?
They told me, no. At first, they told me no, that there was that wasn't the process to do. We'd already reached out and we casted a large net all over Louisiana, all over Texas, and no one accepted your mom. So I went back and told Kim. I was like, Kim, they're not doing it. And Kim was like, get your butt back into the hospital. Go back and tell them that it is the law. We have an admitting physician willing to accept your mom. So what I did then is I took a deep breath. I said a prayer. And then I called a member of my mom's vascular team and told him to get the hospitalist back into the room in 10 minutes. And if he didn't, I was going to unplug the stuff off of my mom and take her out of the hospital. And so I guess they thought I was crazy because in 10 minutes, everybody was back in the room. And that's where I called Kim on the phone and I had everybody there. And we were able to start the process. And that's where the introduction of Dr. Amin came. And I'm just thankful.
But the interesting part was they actually threatened her before I got on the line. They threatened her and said, if you just charge your mom, your only option is amputation.
Yes.
If you choose to take your mom, we're going to stick you with all of the bills for all of her care over the past few weeks. And we're going to talk her out against medical advice. And so she was just caught between a rock and a hard place. And then she puts me on speakerphone and I didn't know what I was getting into. And I just explained the situation. I said, I had Dr. Amin's phone number. You could call him. He said he would receive. And if you can go ahead and initiate the process. And Jay, they actually sat there and Googled Dr. Amin and as soon as they Googled him.
They Googled him in front of me. Yes. And they started sharing. Oh, okay. Well, look, so they started sharing what they Googled to each other.
So do you think this was just a misunderstanding and that just the communication wasn't accurate? I mean, I can't imagine that they were actively trying to keep your mom there to amputate her leg, because you yourself said that they wanted to help her, they just ran out of the tools.
Well, Every other time in that hospital, it was great. My mom has been in the hospital a whole lot, and I'm not like knocking her vascular team, because it wasn't per se her vascular team doing it. Somehow, the hospitalist was more so taking the lead. Someone who wasn't more so knowledge, or educated in my mom's my mom's past, and then another vascular surgeon who was not necessarily my mom's vascular surgeon, who's done all of the procedures, kind of just took over from there. So I can't, I'm thankful for, I want to just definitely be clear. I'm thankful for the vascular team and all of the life-saving surgeries and all of the intervention and all of the things they did to save my mom's leg to this point. But the experience over the last 3 weeks was just horrible and just unreal. And I just felt kind of just really defeated, during the time we were, it was really a bad feeling. And I don't wish that on my worst enemy, but I don't blame or knock her previous vascular team for
But
it.
here's what I can say is that, you can always say 2020 hindsight, but I've seen this over and over again, Dr. Phillips, that if she would have reversed it and, gone back and gone to a doctor who was actually advanced, probably a lot of these alleged it was life or limb saving in the only way they knew how to do. But in doing those major procedures, they limited her options going forward. And so we always say to people, you've got to find an advanced doctor soonest who can actually give you contingency plans with every step of the journey. And we got her, thankfully. Poor Dr. Amin had to clean everything up. But from the
And
bottom
recently,
of my heart,
you just did this, right?
just this week, Dr.
This
Amin.
week. So tell us, what did you think when you found Jay's mom?
Well, first and foremost, I just want to commend Jay for actually reaching out and doing above and beyond for her mom. I mean, a lot of other people do that. And just to be like, look, I'm going to be my mom's advocate and the way we should be for our parents. So I just want to commend you, Jay, for doing that, because not a lot of people do that. So major kudos to you. And so from when I got the call from Kim, well, my buddy Jeremy called me and said, "Hey, look, we've got something going on. Do you mind if Kim reaches out?" I was like, "Sure, what's going on?" And that's the first intro to Kim, and text later. And in the interim, she was like,
Kim is like a dog. Kim is a dog with a bone. Kim's a dog with a bone, man. She's
I didn't realize. She was like, "Well, you may not know what you're getting into, but here we go." I was like, "Okay." And then, so she, as soon as she started, like, "I've got a patient here over there. Got some advanced PAD stuff, need some work." And I was like, "Okay." So as soon as I was texting her, and I started another text with my guy in the virtual care center we have, our nurse practitioner, and I was like, "Hey, do we have any beds?" So in the same time I'm talking with her, I'm trying to find a bed. And he was like, "Yeah, we've got plenty." I was like, "All right, fine." And I told Kim, "Bring her. We got this. This is easy." And this is the mentality of Craig Walker. I worked with Dr. Walker for years, and he's my boss, and he trained me specifically. I did a fellowship initially. And so I'm 7-8 years into this, working with Dr. Walker and at CIS. It's one of those limb salvage operators over here in Lafayette. There's only a few of us here in our practice. But it was just one of those easy knee-jerk reactions for me and be like, "Bring them, we'll take care of it." And it was straightforward, to tell you the truth. It was not a difficult procedure. Now, mind you, I'm a little biased because I've done this for such a long time. So, but about 2.5 later, my first picture, I took this look at the CT first when I sat down. And I looked at the angiogram and I looked at the CT and I was like, "Okay, we've got flow. We can do this." And so I took my first pictures. We came from the arm because I looked at the CT, didn't have any obvious targets to go up and around, start from the femoral area. And from then on, it was 2.5 hours later, and we got flow into the infrapopliteals. And we cleaned everything up, put some stents in the iliacs where there was really no flow. And that was it. And then I gave her a couple of days to what I call pressurize, where opening up the inflow. Then you start opening up the infrapopliteals better, collateral flow. And I brought her back on Friday morning just to see what's going on. And by that time,
yesterday.
I'm sorry?
Yesterday.
Yesterday, yeah, it is yesterday. Yeah. So yesterday morning, we brought her back, and I was really pleasantly surprised. She's got, it's CLI, John. It's just one of those things with a tiny microvascular kind of thrombus and stuff like that. Had a lot of microvascular distal kind of congestion. So it really wasn't much in the foot, and hence the reason I brought her back. And I was like, look, I need to open up some tibials, or at least get some pedal loop going on. And to my pleasant surprise, there was a pedal loop kind of forming down there from just a significant collateral flow. And so before this, there was a lot of collateral formation, which meant that Jay's mom was actually doing some walking and doing what I needed to do. Hence the reason all his collateral flow was there. So I didn't have to do much because and I'm sure you know, John, it's like sometimes you're like, you know what, I'm just going to hold off right here. There's good flow into the foot. Let's not mess up this collateral flow because then you're really going to be in limbo. And so at that point, I just concentrated on purely inflow and just optimized from the popliteal all the way up into the external iliacs. I just kind of did some touch-up work in the femoral SFA space, and that was it, and I left it alone. And then hence the reason I got that yesterday afternoon on my way back from clinic, the nurse practitioner started calling me and said, there's a lot of blood coming from the wounds. I was like, great, that's what we want. This is what I want to see. I mean, you're telling me. And so this is not a bad thing. Just let it bleed a little bit. It means there's good tissue underneath there. And then get the surgeon. That's when, Kim was like, hey, look, what do we need to do? And I was like, well, she made some suggestions and I passed it on to my nurse practitioners and stuff. And, we've got the wounds cleaned up, and I just texted another one to get the wound vac and hyperbaric set up. So we're going to get rocking and rolling here.
And coming up next, right here on the Heart of Innovation, we'll hear next steps aside from what he just mentioned and get some final thoughts. So stay with us right here on the Heart of Innovation. Don't go away.
Leg health can indicate.
And a big thank you to Christy for your flexibility.
No problem.
So just let me know how long we have here. You did, God, Dr. Amin. Holy cow.
No, thank you so much, Dr. Amin. We love you. You're a superhero.
Oh no, that's what I'm here for. Gosh, even John would probably say the same thing. This is what we love to do.
It's always funny too, because so you have to understand, like, when, at least
30
for me,
seconds.
when I hear about a case like that, I'm thinking, man, this is the worst possible situation.
Oh, yeah.
But then sometimes you get in and you're like, this isn't that bad. Like, what are they thinking? I had one lady, they were going to amputate her leg, and it was a popliteal occlusion, and we popped it open, and it was, she's healed out. It's just a head scratcher.
I see that routinely. It's so frustrating.
So we have 4 minutes left.
1220 KDOW. Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
So I have to ask, as we wrap up the show with 4 minutes left, have the piggies been saved?
Dr. Amin?
I think so. I think so. I'm pleasantly optimistic. I think there's a long road to go. But blood flow is just the proof in the pudding. I mean, there's no pun in there, but maybe there is. But I mean, there's blood flow. We know those wounds are pressurized now. There's blood flow leaking from them. I don't see the reason why not. I mean, there's always another opportunity to, if I need to go back in and create some more channels, I could definitely do that. But I think right now, because we have blood flow and we have the tissues that are oozing right now, I think that's a good sign. And
that's the beauty of it too. I mean, you haven't burned any bridges. You still can do more if need be. And, so is she in the OR now getting debrided, or what did she have done today?
I think she should be out of the OR as far as I know, Jay.
She's in recovery.
Yeah, I think they just went for a debridement, and that's when they found all these tissues were actually oozing as much. And I think one of the surgeons had mentioned that ankle one, where the area of the posterior tib didn't look as healthy, but he said it was bleeding, which Kim and I were both somewhat scratching our heads. So I don't know yet. I'll have to do kind of a deeper dive into the chart and stuff like that.
Well done. Well done.
Jay, what is your feeling now? And what is the best advice? You wanted to come on this show. I mean, we've never had someone want to come on this quickly, but you have a very important message that you want everyone to hear.
First and foremost, I thank you, Kim. I thank Dr. Min. I thank you. I think it needs to be more people like you out there. People need to fight. I mean, you have to fight for your family, fight for your loved ones, fight for your health, fight for your life. You know, don't just take the first opinion. Sometimes it requires a second, maybe even a third opinion. And be sure on this. Stand on those words. If you want a second opinion, go for it. It's your life. And today, my mom has blood flow, and she's recovering with blood flow. I mean, as opposed to recovering with an amputation. So, from me, my mom, and my entire family, we are grateful for you, Kim. We're grateful for you, Dr. Min, and we thank you so much. And I just want to tell everyone, don't just take that first opinion. We're talking about cutting off your leg. That's a permanent thing. That's something that you cannot take back. So it's okay. You know, even if people may think you're crazy, it's okay to say, I want a second opinion.
It is, and don't let them threaten you. I mean, it's scary sometimes being in the hospital and they have to tell you what they need to tell you, but you have to take a deep breath. And if your life is on the line, however, you always have to ask, how many times did I ask you that question? Is she,
yes.
Are they worried about her life?
Yes.
And absolutely not. They said it's not even close to being. And I said, if her life is not on the line, then we can move forward. If your life is on the line, it is your life or your limb. And at that point, you have no choice. But always, always, always get a second opinion. And Jay, we just honor you for your.
We've got to get Mom on the show.
Yes, definitely. She would love it.
I need to see what Mom looks like, and we need to see the piggies.
Awesome.
And you have 10 seconds, Dr. Amin. Any final thoughts, advice for people watching?
No, just I agree with Jay. Just reach out. It's do your due diligence. That's all I can say. It's your life.
Listening to
Live it well.
The Heart of Innovation with Emmy Award-winning journalist Kim McNicholas and